There needs to be a system in place for when a doctor-patient relationship is ending, or there's been neglect, incompetence, and the fact that the GPs want to discharge you rather than actually deal with the complaint system and the boo-boo, the mess-up, the incompetence, the neglect, and hear from the patient. If you're going to discharge a patient, always text them, always email them, and always give the prescription 1 month, 2 month, or 3 months prescription to a local pharmacist saying that they are looking for a new GP. Because I've been without a GP for 2 months now and been off one medication for 3 months, and I've been off several medication now for 2 months as well. So that's March and April, and I've been off my Zappa pain for 3 months. So I've had to buy Paramol. I don't normally take aspirin, so I'm getting a bit wheezy, and it makes my blood where I've got piles bleed more. I get ibuprofen and codeine and paracetamol, so I've had to use more paracetamol on its own. Paramol is 21 milligrams less codeine per tablet. I'm substituting the aspirin as a kind of pain drug. It works, but it's not codeine. And then ibuprofen. So if you're ever going to discharge a patient, you can send 1 or 2 or 3 months full medication to a pharmacist, and you can tell them that they were only to be given out month by month, and they're looking for a new GP. You always text the patient on their mobile number, and you always email them, because sometimes we can't open the post mentally. We just can't deal with it. An email we can deal with like in a month or 3 weeks or a couple of days, or we can forward the email to someone. And a text message, well, we will just see it, unfortunately, but we can also try and pass it on to someone else that can deal with it for us on our behalf. So Goldington Avenue in Bedford, that is Goldington Avenue in Bedford, also known as Union Street Clinic, partnership to Goldington Avenue, have basically, well, put me in a lot of danger. And the day that they also went, oh, there seems to be a complaint within those emails and letters that you've sent us, I tried to commit suicide on the same day that they sent a letter, which I wouldn't have known about because I haven't opened it till April, that said, oh, we're discharging you. We might look into the complaint. The reason I gave them 21 years worth of history is because I've already been told by the GP that left, said they can't just pick like 2017 NHS search and get the letters. So I gave them history, and then I put my complaint. I think I put a 9-page complaint in, and then I gave them 21 years history to show that it isn't just me that says I've got complex regional pain syndrome type 1. It isn't just me that says I've got mid-carpal instability. It isn't just me that explains why I'm on the medication. I've never, ever bloody stockpiled Zappa pain. I take the bloody drug daily, anywhere between 6 or 10 tablets, or 6 and 8 tablets, or 7 tablets a day. And that I'd been on since 2010 at that dose, 224 a month, to January 2023, safely. I've only tried to commit suicide on painkillers 3 times, 2007, 2010 and 2017, and that was every time I did that, I had no access to a razor blade. If I'd had access to a razor blade, I would have never have used, and I only use what I've got left. So if I have 10, that's what I take. If I've got 60, I take 60. If I had 3, I'd take 3, but then I'd combine it with like another drug to try and overdose. Opiate stigma has reached the NHS from America, and it's reached the NHS badly. Pain specialists are frightened of opiates now. GPs are frightened of opiates now. It's been here for a long while. I know that East London Foundation Trust 2014 labelled me a drug addict, and I was like, read the pinned post on my Instagram, it's the third one. I had to get my pain specialist just to try and explain. I still got barred from East London Foundation Trust because they didn't do a great investigation. They didn't let me have access to my records. They didn't point me to VoiceAbility or for these are advocacies that work on your behalf that make sure the complaint's being done seriously. And they didn't wait to hear from the pain specialist. They didn't wait to hear from my GP. So the stigma's been here for a while, but thankfully the psychiatrist could only ban me from mental health therapy to see a psychologist, a psychiatric nurse, a psychiatrist, mentalised based therapy groups for BPD. She couldn't take me off my tablets. The GP, unfortunately, in Goldington Avenue, Union Street, took me off my tablets as of February. And then when I started getting extra pain, lack of sleep, spiralling, and I said I'm spiralling, and I said I'm probably going to do something stupid, which I did on the 17th of February, the deepest cut in 21 years. The deepest cut in 21 years. And I also know how not to cut the tendons or the ligaments or the soft tissue. I know how to look for veins. And if I'd had a better implement, I had to break apart an orange disposable razor. If they'd sold the Stanley knife, I'd either be on a psych ward still and having plastic surgery, or I'd be dead. And Goldington Avenue already knew I was spiralling. Now I've got no GP for 2 months. I've tried to register with Caudwell Medical Centre. So I registered with them on the 13th of March 2023. I told them that I needed medication. I told them on the 24th of March 2023 face to face. Then I told them on the phone of the 4th of April 2023. Then we phoned them yesterday and they said I'm on a restricted scheme, and they couldn't tell me why I was on a restricted scheme, and they can't tell me till Monday. Then they said, oh, don't worry, one of our pharmacists will phone you and we'll get you back on all your medication, and they'll be phoning yesterday. That never happened. And so, and the Bedford Independent has already said the worst GPs per population of the whole of the UK, of GP surgeries per population, is the whole of Bedford, out of the whole of the UK. Not the NHS bit of it, the hospitals or the pain management. The worst. 3 doctors left me. One was my main GP in the pandemic. One did my repeat prescriptions quite often, so they would have to look at why I was on the drugs. Although I never spoke to them, they would have looked through my records. And another one I saw in 2018, all 3 of them that were looking after me went. And then when they were meant to be looking after me as a new GP, they never bothered to make an appointment. The GP that caused my nervous breakdown in 2016 of September, 2016? Yeah, of September 2016, 19th of September 2016. And I was on the NHS Safe Treatment Scheme for 1 year. And when I got off of it, I googled what was the best doctors at the time, and the best doctors at the time was Goldington Avenue Surgery. I didn't get the best treatment. They were like, well, we don't pester MSK Circle, we don't go to the MP here. Yes, we're bankrupt. It's like Hackney NHS Trust was bankrupt all my life. 1984 to 2017, it was bankrupt all the time. But they sent patients where they needed to go and gave them the treatments they needed, because it will be more expensive for every patient that spirals mentally. They go to another service. They can either end up in the outpatients or they could end up on a mental health ward. And that's going to cost more than giving me like twice a year pain jabs, or sending me to a pain management program as promised in 2019, a group therapy. So you speak about more about the pain, more about coping with the pain, how you had that accident, what you're suffering, blah, blah, blah. It doesn't focus on the mental health alone. It focuses on the chronic pain as well. And I can't help it that I tried to get my GP surgery at Goldington to understand mid-carpal instability, and I tried to get them to understand complex regional pain syndrome. And between 2020-ish, I don't know exactly when it started, to about 2022 to 2023, Florence Bull House East London Foundation Trust in Bedford, under several staff or psychiatrists, said, look, hi Goldington, will you see Scott? Also, Goldington, will you send Scott to MSK Circle for a pain management referral? He would like to go back to Adam Brooks. Please sort this out. You probably don't need to see him in person. He can be sent straight to MSK Circle. Again, they neglected this. They neglected the stellar ganglion block referrals, both MSK Circle and Goldington, in 2019 by an MSK Circle blooming doctor, a consultant, and they ignored the blooming doctor MSK Circle for pain management program group therapies as well in October 2019. Both Goldington and MSK Circle. You have to be bloody political. Do you know why you have to be political? Politics affects everything. If you don't know that, there's two scenarios: dictatorship and politics. They still affect everything. That means if the government wanted to suddenly go, right, we're only going to have one ply toilet paper to save the climate, well, that's what we would have. If the government wanted to turn around and go, right, we're going to give billionaires trillions of pounds in refunds, in tax rebates, well, they do that because the Tory party are corrupt. They're destroying the NHS. I support junior doctor strikes. I support the NHS strikes. I support all strikes in this country. I don't care whether they're Royal Mail, which is private, or the NHS. When the Tory government have been in power for 13 years, they used to blame the EU for their fuck-ups. Now they blame someone else. Woke. The left. The woke aren't in power. The left aren't in power. We don't have a majority. You know, we have weak trade unions. We have biased media. If you don't know that, most of it is literally owned by toxic Rupert Murdoch kind of people, and they want you to hate the trans, and they want you to hate LGBT, they want you to hate the left, they want you to hate the woke. They want you to do that while your country falls to shit. And this happens in America and the UK because the conservative media and big businesses buy the Tory party or the Conservative Party and buy conservative people. It's easy, they fund them. Historically, the Conservative Party in the UK is about 200 to 400 years old. They do the same with the rigged, unelected House of Lords. They buy them. and then they prop them up, and they both prop each other up in a nasty bit,